membership at Women in Business, and we're delighted to welcome you here this evening to our event, Well Women in Agriculture, in partnership with the Ulster Farmers Union. You're very, very welcome. We have a sterling group of panellists this evening to talk to you on a range of topics. I'm just going to do a very quick introduction of all the panellists, first of all, so you know who's going to be speaking to you this evening. So we've Michael Gibson, who's a County Down farmer and manual therapist, and he's going to talk to us about how he approaches aches and pains in the context of working on the farm to help farmers prompt self-evaluation of own home scenarios, and he's going to be giving us practical tips to help prevent future issues. We've also got Dr. Lindsey Harrison, who's a GP, and she's going to be taking us through straightforward know your numbers, so emphasis on accessibility to blood pressure checks and knowing your cholesterol. We've also got James Nicholl with us this evening, who's a lead pharmacist in emergency medicine in the Northern Healthcare Trust. We've Dr. Rachel McCrabb, a County Tyrone GP partner who comes from a farming family, and she's going to lead a discussion for us around women's health. We've also got Dr. Miriam Dolan, who hasn't joined the call just yet, but will be joining us later, and she's a GP partner in County Fermanagh. And finally, we've got Veronica Morris, who's the Chief Executive of Rural Support, and she's going to finish off this evening by showcasing the rural support role in supporting farm families to look at the whole farm health as part of protecting your personal health and well-being. So as I said, great lineup of 6 panellists for you this evening. Our plan for tonight is we had advertised the webinar from 7 to 8, but because we have 6 panelists, what we're going to have is the main content session of tonight's webinar will be 60 minutes, and then we're going to allow time for Q&A at the end. So we do expect the webinar to be finished by 8:15. What we would do is encourage you then during the sessions and as the panelists are speaking, do feel free to put your questions into the chat, and we'll try and deal with those questions if we go through. If not, we'll deal with them then at the end. I should also say then this evening that we have slides and info sheets that will be sent to you after tonight. So do try and relax and enjoy and engage with the content this evening. And as I say, the follow-up slides and presentations will be sent to you after tonight's event. Okay, so without further ado, we're going to make a start. Michael Gibson's up first with us this morning, as I say, this evening, sorry. So used to doing these events during the day. Michael is a County Down dairy farmer, and we're going to start off with you, Michael. So first of all, can you tell us a little bit about yourself?
How you doing, Lydia? Well, thank you very much for introducing me. Well, I'm Michael Gibson, Ballynahinch, County Down. Shortly after I left school, wasn't too sure what to do with myself, and like a lot of dairy farmers around this part of the world, I wondered what else I could maybe do, diversify a wee bit perhaps. So went and did a 2-year diploma after the degree as a massage therapist, a wee bit of work with sort of clubs and teams in the area. But I found out they wanted your evenings, they wanted your weekends, and I wasn't really willing to give a whole lot of that up. So I ended up working with quite a few people in the local community with sort of aches and pains and bits and pieces. I found this to be a lot more enjoyable, a lot more rewarding, and a lot more to relate with people. So down the line, I've went over across the water, did a diploma in osteopathic sort of techniques, manipulations, and I found that really helped a whole lot. But what I'm here to talk about tonight will be one of the main things I would see people working in agriculture, and we're going to focus a wee bit on women as well, will be lower back pain. So since about 1990, it has been the leading cause of global disability. Most costly condition to occupational health, 80% of people across all populations having a wee bit of trouble at some stage. So probably just start off and see with agriculture what pertains to a lot of the problems that people would get. So yeah.
Okay. Okay, so yeah, great. No, thanks for that. Thanks for that intro. So as you've said, then the aches and pains in joints and muscles then are very much a leading cause of disability within the farming population. So in modern farming, what are, in your opinion, the main risk factors then for developing lower back pain? What's causing all this within the farming community?
Well, from a purely anecdotal point of view, I don't think anyone's written a paper on this yet. What I have noticed is modern agriculture has changed quite a lot over the last 50 years, with mechanization being quite a large part. Manual labour has decreased quite a bit as well. So a lot of the sort of aches, pains, back problems I would see would be coming from working in a seated position. So as everybody now is quite used to working with machinery, one of the big risk factors for back problems would be sort of stiffness in the hips. So if you do find yourself stuck in the cab of the tractor, or if you're in the house doing your paperwork, as everyone who's coming up to the red tractor inspection knows all too well, it can cause a few wee troubles down the line. So if you find yourself a wee bit stiff getting up out of bed in the morning, or maybe you've been sitting getting the tea and you're just not springing up quite like you used to be, that would be a wee thing to look out for.
Great. Okay, and then in terms of women specifically, then obviously being women in business, and our focus tonight is on women, although I appreciate we've got men in the audience too, but any particular considerations then that women should be made aware of?
The main thing, well, for both populations, well, just to start off, would be farm safety is a big thing as well, making sure, especially when it comes to handling facilities, making sure that everything's safe and everybody's aware of what's going on. For women in particular, the main difference would be, from my experience, would be around pregnancy and sort of post-childbirth would be the big things. Sometimes whenever you maybe, obviously it's a big life change to go through, but there's other things that pertain to women, like say hormonal factors, like say the hormone progesterone. If at different times of the month and different periods in pregnancy can cause almost like a laxity in the ligaments. So if you've ever had any history of any injuries, that can soon cause them to almost rear their head a wee bit again. But it can also be taken into consideration if you're doing any heavy lifting or any repetitive work. So that can be a wee factor for women especially.
Definitely. I'm convinced since I've had my own 2 children, my back's has never been the same since. So I blame the children. On that one. So what can we do then? What can we do, or what can be done by ourselves then to minimise the risk factors then within the farming sector?
Well, I had a very interesting lecture a while years ago, and he says when observing the patient, you may find hard skin on the soles of the feet. Some you'll find it on the palm of the hand, but he says, I'm yet to find anyone with it on their backside. So the big thing that I found makes the difference is getting out and getting physically active. And as you know, especially coming up the winter time, you're walking around the yard, keeping an eye on stock and just walking around the ground and stuff. Getting out and walking would probably be one of the things that moves the needle better than anything. A wee thing that I found to be quite beneficial is the wee fitness tracker watches that everybody seems to have now.
Yeah, got mine too.
Oh, they're a great job. Wee thing I found is the 10,000 steps definitely helps an awful lot whenever it comes to musculoskeletal problems. It gets you up on your one end, gets everything moving the way it's supposed to be. It's very good for your digestion. It's very good for a lot of things. Plus, with the wee watches, they're very, very good for tracking your activity and your sleep. As you know, by the time you get the reading up done, it's usually quite enough for most people. But coming up to the winter time, a wee thing that doesn't do any harm, there's an awful lot of gyms around the country now, and there's not much to do in the evenings. And if you can find yourself, even in class, you can go to your friends, or even the leisure centres have a lot going on. If you have an hour in the week, it goes a long way in the grand scheme of things. But even for all populations, if you look at everyone as they get older, the 2 big things that keep you going for longer are your leg strength and your foot speed. So if you're out exercising, you're a lot less likely to have a fall as you get older. You're a lot less likely to get stuck in the chair, and you're likely to do better for longer. So that would be a few things that I would keep an eye out for.
Yeah, definitely keep moving. Don't sit still. Okay, can you give us then, in terms of why would you say it's important for us to seek advice from a professional then if you are suffering any joint or muscle aches or pains?
Well, as you well know, whenever you're working in agriculture, there's the sick leave wouldn't be very good, as is the holiday pay. But you have to look after yourself if you want to stay in this career for a long time. A few wee things to look out for. As we mentioned earlier, up to 80% of people do experience some sort of, say, lower back pain at different times. A lot of the time it walks off just depending on the nature of the work or the activities that you're doing at the time. Like say, if you have been maybe out spreading slurry for a while, or maybe you've been picking stones, is not great for the back either. But if you have a persistent lower back pain, it's definitely worth getting in touch with your GP. From there, they could either refer you to self-referral to a physio in-house. If you have someone in your area who would be a musculoskeletal therapist, there's some very good physiotherapists, osteopaths, and some chiropractors around the country. If you're upfront with them and say, look, here's the sort of persistent trouble that I'm having, they can do a proper screen, make sure that there's no red flags, as we'll call it, for serious neurological issues or otherwise, and then they can help direct you in the right direction.
Great. Okay. Great advice and guidance. Thanks very much for that, Michael. If anybody has any questions, do feel free to pop them there in the chat. And as I say, we will deal with them. If you're happy enough, Michael, then we're going to move on to our next panelist. That's Dr. Lindsey Harrison. Lindsey, are you ready to join the conversation?
Thank you, Lydia.
Thank you. We will come back to you, Michael, at the end. Don't worry. So, Lindsey, over to you. You're going to talk to us about knowing your numbers. Do you want to tell us a little bit about yourself, first of all?
Yes, so hello everybody. My name is Lindsey Harrison. I'm a newly qualified GP. I'm working at the minute as a locum in County Antrim around the North Coast area. So the practice I'm with the most of the minute is in Ballycastle. So I'm interested in rural healthcare and providing good quality healthcare to people in rural areas. Just out of interest, Ballycastle, we do cover Rathlin Island. It's a even different level again of rural healthcare, just with issues with access and providing emergency medical care can be challenging as well at times. We have plans in places, and every 2 months we go over and do an outreach clinic over there, just so patients don't have to travel, because there are quite a few elderly patients on the island as well. So that's just an area of interest. I been married to my husband Robert, a dairy and beef farmer, for over 2 years now. So I've moved up to this lovely part of the world, so also adjusting to a new area. So tonight I've been asked to speak just a bit about blood pressure, diabetes and cholesterol. And the reason these topics are so important is they sort of form our general risk for cardiovascular disease. And cardiovascular disease is basically any disease that affects the heart and blood vessels. It's really, really important. There's many different types. From the heart, you can have angina, and going on to a heart attack. There's different forms of strokes and TIAs, which are mini strokes. And then you can also get peripheral vascular disease, which is a blockage to the legs. So the reason it's so important is we know in Northern Ireland, cardiovascular disease is one of the largest cause of death and disability in Northern Ireland. In fact, 19% of all premature deaths in Northern Ireland, which is about 1,100 a year, are caused by cardiovascular disease. So just in the general community and in the rural community, it is very, very important. Now, specifically when I was looking up, there's not a lot of data on female farmers, unfortunately. So most of the data is on males. This may just be traditionally the male population are more likely to be involved in farming. But there was one study started last year down in the Republic of Ireland of over 800 farmers that they recruited. And just some of the points I found quite interesting from it is that 74%, so nearly 3/4 of the male farmers recruited, had 4 or more risk factors for cardiovascular disease. So that's an incredible amount. And it meant that they're 3 times more likely to suffer from a cardiac event, whether that be a stroke or a heart attack, than the general population. Some of the more worrying results from the study, even though farmers generally good health and physical activity wise, some of the points from it were that 85% were actually classified as overweight or obese, compared to the national average in the south, which is only 68%. Also 80% of farmers, the male farmers, had a high risk waist circumference. So what this means for men is a waist circumference of over 37 inches. And for women, it's a waist circumference over 35 inches, which is high risk. Anything below 31.5 is seen as a very low risk weight for circumference for developing cardiovascular disease. So I suppose firstly, in regards to high blood pressure, or sometimes you might hear your doctor call it hypertension. So we know that high blood pressure is present in half of all strokes and heart attacks. So it's a massive risk factor for developing a stroke or a heart attack. If you're at your GP, we normally would diagnose high blood pressure at anything over 140, over 90. But we like average is about 120 over 80. So I really would encourage you, I know access can be difficult at the minute with your GP, but even if you can get a treatment room appointment or even go into your local pharmacy, they all have blood pressure monitors, or even some people buy a blood pressure monitor to have at home. And just, check your blood pressure out and just keep a wee eye. And if you have any concerns, speak to your GP. Ways that we can self-help to reduce our blood pressure, which I'll chat a wee bit more about as we go along, are healthy diet, exercising, reducing alcohol and salt intake as well. and quitting smoking. I know most people on here will be getting more than adequate of their exercise. We normally recommend about 150 minutes a week, but as busy farmers, you will definitely be getting more than your exercise. But just out of interest though, you know, baby farming isn't as fit or as manual as it used to be. You know, lots of farmers nowadays have quads, you know, a lot more machinery. So it's maybe actually not as manual as it has been in the past. Moving on then to cholesterol. So cholesterol is basically a buildup of fatty substances in our blood, which can cause our blood vessels to narrow and can eventually put you increased risk of having a clot. So some of the numbers we like for cholesterol, or we like our total cholesterol to be less than 5. So this is your overall good and bad cholesterol, which if you get a point cholesterol taken maybe at the Farm Families Health Check, they'll likely have your total cholesterol. And when you go to GP, we get a breakdown of your cholesterol, and one of the other factors we look at is what we call your bad cholesterol, and we like it to be below 3. So those are the two main things we look for when looking for your cholesterol. With regards trying to help cut down cholesterol, it is difficult. I would encourage you to look at the labeling now on foods is great. When you go into the shop, you know, it's very easy, traffic-like system, and specifically look for the saturated fat, and ideally it shouldn't be red if you're buying things. But it is difficult to eat a healthy diet whenever you're busy on the farm. Certain times of the year there's a lot more pressures, slurry time, silage, lambing time, and it is hard to keep a good diet up at all times. Some simple things are, you know, thinking about maybe batch cooking earlier in the week, so that you have something to throw in the microwave that is substantial and that is healthy. So that is really cholesterol. One other thing I want to chat about just briefly is diabetes. So diabetes is very prevalent in Northern Ireland and in the Western world. Some of the symptoms to look out for are increased thirst, increased going to the toilet, so passing urine, and just general tiredness or lethargy. So if you have any worries about any of those concerns, you know, speak to your GP and we can get you tested for diabetes, especially if you have a family history. As we know, it does run in families. So important things to think about trying to reduce your risk of diabetes are really trying to keep sugar to the minimum. So they are. So even simple things, you know, if you're trying to get more fruit and vegetables in your diet, you know, throw in some peas and carrots into your rice, if you're making a curry, or into pasta bakes, you know, add a handful of your berries to breakfast, to porridge or something like that. Just a thing just to watch out for in diabetes is some starchy foods can be quite high in what we call GI, glycemic index. So that can be things like your white bread and white pasta. So ideally, if you can, substitute those for more whole grain type pasta and whole grain type foods. They'll also help with keeping the bowels regular too as well. So I suppose cardiovascular wise, it's really difficult. It's more prevention is key in this area. Okay. Unfortunately, as GPs, you know, we can't predict who's going to have a stroke, who's going to have a heart attack. But what we can do is try and reduce your risk as much as possible. So I would just encourage you, you know, if you have any concerns, I know access is at the minute in GP sometimes quite difficult, but if you know, can get booked in, as I say, with your treatment room nurse just to get cholesterol, diabetes check, and get your weight done, and then you can take things from there. So yeah, that's me.
Great. Thank you, Lindsay. Great whistle stop tour there of all things blood pressure, cholesterol and diabetes. That's excellent kind of overview. Questions coming through there, or comment coming through obviously from Rebecca to everybody. I'm sure you can see that BMI, cholesterol, BP and diabetes screening all now available as part of your health screen with your Farm Family Health Check, so you can know your numbers instantly on the day. That's great. And again, everybody, if you have any questions as we go through for any of our panelists, do feel free to pop them in the chat and we will try and deal with them as we go through. Okay, moving on from Lindsay then, as I say, we're moving at a pace now tonight on to James Nicol, who's lead pharmacist for emergency medicine in the Northern Healthcare Trust. Over to you, James. Are you with us. I don't see you on screen. Just give me a
I am.
second.
I'm
There
here.
you are. There you are there.
I was just thinking I could have just done with Michael about a month ago after lifting a couple of kilos worth of stones to try and sort it back again. But
Yeah. So
however,
James, yeah, you've got a short presentation then for us this evening. So we'll hand over to you.
It's only 2 slides.
Okay.
I'm just trying to get this view sorted. Hold on, sorry. Yeah, there we go. So, no, all I want to talk about tonight really is the role of pharmacy and pharmacists, and then a wee bit about medication safety. Just a wee bit about me. As I've said, I work in A&E, mostly either in Causeway A&E department or else up in Antrim as well. So all these strokes and heart attacks that Lindsay's talking about, we get them at the acute end of things when they haven't followed the advice and they haven't taken the tablets, and then they end up in with ourselves. So that's where I work. We also run store cattle here at home as well. So that keeps me busy in the evenings and the weekends. But just tonight, very quickly, pharmacy has perhaps changed a wee bit over the last few years, especially about the last 10 years, with more services available in community pharmacies, as well as in GP practices. So community pharmacies, to start with, obviously still do the dispensing of all the medication, but and the over-the-counter medicines. But some folk and most folk will probably know that most of them will now offer a stop smoking scheme. So if anybody is keen or interested in finding out more information or wanting to actively stop smoking, then you can go to your chemist. It's free of charge. They can provide you with the patches, and then with the support and the follow-up appointments every week or two, just to see how you're getting on. And that will increase your chances of being able to successfully give up smoking. They also offer a minor ailments scheme as well. So you can just check what ailments. There'll be posters up in the chemist shops as to what ailments are included in the minor ailments scheme. And again, you can just go up and have a consultation with the pharmacist in the shop, and then they can advise what would be the best thing that they can give you. Or else, if there's nothing that they think they can treat in the chemist, then they can direct you on to get appropriate care elsewhere. They also can do medicines use reviews, so they can just go through all your medicines and see what you're taking and try and get them all aligned for you as well. So as you're not ordering repeat prescriptions every week, it's handy to get them all aligned and into one order. Also, just in what Lindsay was saying there with regards to blood pressure checks, there are most pharmacies now will offer blood pressure monitoring. They have machines within the shops. Some of them actually even can do blood sugar tests as well, and there's some of them that will do cholesterol checks as well. So it's just another point of contact. We know that that access to healthcare at the minute is quite slow, just with the after effects of the pandemic, but at least that's another option maybe to go and get things checked out. And then, of course, the other thing that the pharmacies are doing are the vaccines. So I think we'll probably hear more about this with the COVID vaccine going forward, but it's also worth bearing in mind that they are able to do the flu vaccines as well. So there's a lot of the shops are now doing flu vaccines every year. And again, it's just another place to go, and it increases then the number of places you can go to get these things. Moving on then just into GP practices as well, something that's relatively new within the last 10 years, probably within the last 5 years really, that most practices now will have a practice pharmacist, if not all the time, certainly part of the time, and they'll be there and they can help to sort out a lot of the medication issues and sort out repeat prescriptions, and some of them are taking clinics and stuff as well, just to treat them the longer term conditions. So again, it's worthwhile keeping in mind that in your GP practice, if you have something that is a medicine related query, that they are a good person to talk to as well. And then in hospital, and hopefully you'll not end up in hospital, but you're more likely now to see some of us when you are in. So if you're at the start of your admission to hospital, you'll likely see a pharmacist, as well as during your stay and then at discharge as well, and then working on in the background just to make sure that everything goes smoothly as possible with regards to the treatment of while you're in hospital and your medications on discharge. Second thing I just want to mention briefly tonight is medication safety. This actually links in quite well with what some of the stuff the Department of Health are trying to do around transforming medication safety in Northern Ireland, which was a document that was produced last year in response to the World Health Organization's third global health challenge on medication without harm. So within Northern Ireland every year there's about 41.9 million prescription items dispensed in community pharmacies, which is some number of tablets. And 4 in 10 adults are on 5 or more different drugs. It's also interesting that a survey that was done showed that only 16% of people who are prescribed a new medicine take the medicine as they're prescribed it, experience no problems, and think they received as much information as they feel they need. So there's a big room for improvement there. So what the message would be is that we're trying to encourage you to take an active role in the management of your own medications as well. Not only maybe for yourself, but for your elderly relatives, perhaps if they're on medication, or perhaps a spouse or a partner as well. It's a common thing. You go to somebody in hospital that's been admitted, that's usually a farmer, and you'll ask them what tablets were they on before they come in. And invariably they say, you didn't ask me, it's the wife that you'll need to talk to, or the daughter. So it's just important to know what medications are on, and familiarise yourself with what you're taking yourself, but maybe if you're looking after medication for somebody else as well. So the second slide then that's up there tonight just shows the 5 changes for medication safety, or the 5 points. So firstly, you've got when you start a medication. So it's just questions that perhaps you'd like to ask, just to make sure that you know what the name of it is and what you're taking it for, how long you should be taking it for, and how do you know it's working. A good example of how do you know it's working is, as Lindsay's been talking about, blood pressure. What the main way of treating high blood pressure is through medication. People say, oh, how do I know this blood pressure medication is working? Well, on an everyday basis, you probably not notice a whole lot of difference. But when you go to get your blood pressures checked and they are back within normal limits again, that's how you know it's working. So it's not that you're going to necessarily feel wonderfully better if we get your blood pressure back within normal limits, unless it has been sitting extremely high. You're not going to see any difference, but it is important then that medication is continued to be taken, as Lindsay has pointed out. And what the side effects are, and what to do if you do experience the side effects then. There are a good source of information is the information leaflets that come within the boxes of tablets, although they go into a whole heap of detail of every possible side effect that the medication has ever caused. So sometimes it's handier and it's better maybe just to ask the likes of your GP or your pharmacist what the main side effects of the medication are, if there are any, and what to look out for. And then it saves you reading through and getting worried about a whole list of side effects that probably will never affect you. Then while taking your medication, it's the questions there are, how much should I be taking and when should I be taking it? So we know that there's some tablets that are better taken with food. There's others that are better taken at night, like some of the cholesterol tablets. And then there's some that are best taken first thing in the morning before any food, like some of the stomach tablets and some of the tablets for bone protection as well, like the once weekly bisphosphonate tablets. Adding in a medication then, so an important question to ask there is that if you're in hospital and been discharged, or if the GP's adding in another medication, does this replace any of my existing medications? So is this to instead of, or is this on top of? Just to make sure that it's well, so as you know whether you're supposed to continue taking your medications as you are, especially when you're coming out of hospital, because I think it's about 40% of patients' medication will have changed during their hospital inpatient stay. So it's important just to know what they are and if there are any changes when you come back out. And then reviewing your medications. So are there any medications you no longer need? So we know that there are people that are put on medications and then stay on them for a long time. And perhaps the reason that they were taking them in the first place isn't there anymore. They don't need them. So it's just important and to get those medications reviewed to make sure that the tablets you're on are appropriate for you and your condition at the minute, and that you're not taking more than what you need to. And then stopping medication, and I suppose the questions would be, when should I stop taking it? So antibiotics, for example, normally you'll be prescribed an antibiotic for a set course of time, either 3, 5, 7 days or 2 weeks. And it is important that you take it for that duration. Rest assured that we won't be prescribing them for any longer than what we think you need them for. But it is important to finish the course. You might be feeling better before that, but it's just to make sure that the infection is properly cleared up before you stop taking them, to reduce the risk of resistance and to reduce the risk of the infection coming back as well. It's important as well that if you have stopped any medications yourself, that you, without first consulting with your GP or pharmacist, is just tell somebody that you have, and then the reasons why. So if it's because of side effects, talk to some of us and we can maybe prescribe something different. Or if you have any problems or worries or concerns about your medication that has caused you to stop taking it, then it's worth having a discussion just to make sure that it's not a medication that we feel that you really would be better having because of underlying risk factors. Finally, my last point really is that if there's any problems taking your medication in terms of not being able to open the bottles or measure out liquids, there are practical aids that you can get and can be supplied with just to help you with opening up of bottles or helping you to measure out liquids as well. So it's worth discussing any of these issues again with either your GP or your pharmacist. And then the points of contact, if you have anything medication related, are your community pharmacist, your GP practice pharmacist, and then your GP as well. So that's really all I have to say.
Yeah, no, thanks so much for that, James. That was excellent. A couple of questions coming through there for you, if you don't mind taking these. So Louise is asking, James, how do pharmacies market the minor ailment scheme, as this is not something widely known about, but is obviously it's a very useful experience or useful to have.
It's an interesting one because they can't go and actively promote it. So there is posters up in chemists. So you'll see, I think they're blue and white and green posters with the list of conditions. Also, probably if you Google it as well, the Northern Ireland Community Pharmacy Minor Ailment Scheme, you'll get a list of the conditions that are on it there. The list is changing all the time, which is why I can't really provide you with an accurate, and there's some places will provide more than other places will. So it's, again, I can't really give a definitive list there either.
Great. Okay. And then another question coming through from Jennifer then, do you find that people can become complacent about checking on the side effects associated with taking long-term medication and asking if there's a better, lower risk alternative now when reordering long-term repeat prescriptions? So basically people are just kind of always hit the repeat button, but do you find that people are kind of challenging maybe the medication that they're on or asking are there alternatives that they should be taking?
I think this is part of what we're trying to say, is that it is good to challenge those things as well, just to see if there are any things. I know that GP surgeries are very busy, but one of the roles of the practice pharmacist is sometimes to review those medications just to see, are they still required, or is there anything that's better? You know, has management changed? So has the guidelines changed around the management of stroke, for example, and therefore do medications need to be updated? Similarly, if you're ever into hospital, a lot of that will be looked at as well. But it's good, if you have any questions or any concerns, just raise them. And yes, certainly somebody can have a look. Okay, excellent, James. Thank you very much. I must have been a big advocate of my local pharmacist myself. I had my flu vaccine on Friday there at the local pharmacy, so just totally hassle-free, booking online, everything. Job done in and out in 10 minutes, so can't complain. Okay, James, thanks for your input so far. We're going to move on now to Dr. Rachel McCrae, who's a County Tyrone GP partner. So Rachel, can you come off mute and talk to us? So you're going to take us through women's health. Can you just briefly tell us a little bit about yourself before you're going to do a whistle-stop tour of women's health in less than 10 minutes?
Hi, Lydia. So I'm Rachel McCrae. I'm a GP in Western Rural Healthcare, which is a large GP practice spread over 3 sites in Castlederrick, Newton Stewart and Ederney. I work primarily from the Castlederrick site. I'm from a farming background and I married a farmer from Oma, but unfortunately I can't say I do much farming myself. but I'm a good supportive farmer's wife, I guess. Yeah, what else can I say? I'm off on maternity leave at the minute. I've had a wee baby there a few months ago, so just feel like I'm having to scratch my brain a wee bit more than usual, just to refresh my memory and all this stuff. But one of the first things I wanted to talk about this evening was breast cancer, because October is Breast Cancer Awareness Month. So I don't know how many people know, but 1 in 8 women will develop breast cancer in their lifetime, which is quite a staggering statistic. And breast cancer accounts for about 30% of all cancers in women. Something else I thought people might not know is that breast cancer can affect men as well, although obviously much less commonly than in women. And there's this whole concept called breast aware, which is really getting to know your own breasts, essentially, examining yourself on a regular basis, getting to know what feels normal for you, and examining yourself regularly. And basically then, if there was ever a change or a concern, that you would pick up on it fairly quickly and be able to report it to your GP. So some of the things to look out for, the main one that most people would know about would be a lump. So that could be a lump in the breast or indeed in the underarm. There might be skin changes, there might be thickening of the skin, an area of redness, puckering, dimpling. There might be a change in size or shape of one or both breasts. There might be nipple discharge, which can often be blood stained. Change in the position of your nipple. Quite often we would see a nipple inversion in breast cancers. And sometimes pain as well, although whilst quite a common symptom, breast pain is not an overly common sign of breast cancer, thankfully. But basically, if you notice any of these changes at all, get in contact with your GP immediately. What you should expect, your GP should take a history and assess your risk of having breast cancer, whether there's maybe a family history or things like that. You should expect that your GP would bring you into the surgery and do an examination of the breasts as well. And if there was a positive finding on examination, that the GP would then refer you on to a breast clinic, which, if there's a concern about breast cancer, you would expect to be seen fairly quickly within a couple of weeks. What else can we say? I suppose how often maybe should we be examining our breasts? So they say once a month. So generally about a week after your period starts, or if you're a woman that no longer has periods, just once a month, either on the first of the month or on a particular date that's memorable. And what you do, there's kind of in 2 parts. You'd stand in front of a mirror and just have a look at the breasts initially. So you'd want to do just stand with your arms by your side initially, then raise both arms above your head and lean forward as well. And you're just looking for any of the changes here that you can see in this little infographic, all those symptoms that I mentioned. The other thing then, apart from obviously looking, is having a feel of the breasts, and probably the easiest place to do that is in the shower, and just examine each breast in turn with soapy hands. So use your right hand to examine your left breast and vice versa, and just use the flat of your fingers and move around the breast, covering all the tissue in a kind of clockwise direction, going right up to your collarbone and into your underarm as well. And as I say, anything that you find, anything concerning that just doesn't seem right at all, just contact your GP immediately and you should be dealt with fairly quickly.
Great.
Yeah, breast screening as part of self-care. The Northern Ireland Breast Cancer Screening Programme screens women between the ages of 50 and 70 every 3 years. They're called for a mammogram. Sometimes, for women that fall outside this age range, Action Cancer, the big bus, will do breast screening for women aged 40 to 49 and above over 70. And I think they offer that every couple of years, but it's important to note that's really just for women that just want a bit of reassurance. If you have any concerns regarding your breasts or any symptoms, then your GP should be your first port of call, really. So.
Definitely. Thank you very much, Rachel. As I would say, if in doubt, check it out. Don't be afraid to lift the phone and speak to your GP. I think that's one of the key messages to get across, you know.
Yeah.
Excellent. Okay. Well, look, thank you very much for your contribution so far. As I say, we're still moving at a pace through everybody. Next,
I have another quick topic. Sorry.
Oh, sorry.
I just wanted to mention.
Go ahead. Oh, the screen is frozen for me. I don't know if it's frozen for anybody else. Yeah. Okay, do you know what? So maybe come back, our signal's maybe gone. Okay, we'll move on. Dr. Miriam Dolan has now joined us. Miriam, you're very, very welcome this evening. You're a GP partner in County Fermanagh. So if we could just get you to introduce yourself very briefly and then lead us into your topic for this evening.
Thanks, Leah. Yeah, I will keep it briefly, the introduction. So yeah, my name is Miriam Dolan. I'm originally from the Netherlands, so that explains the accent and also the looks. So I'm here now in our 20 years. I fell in love with an Irish farmer, so that explains why I moved here. And I'm working in Lisnowski, again, a kind of big practice, because we had to merge, a lot of practices had to merge really to try to, you know, continue providing care to a big rural population. I'm passionate about rural healthcare and also looking at ways of getting more remote and technology up and going in our practice. When we talk about, for example, blood pressure monitoring, I really strongly believe that people should, it is not really an illness, it is a risk factor. So we're having now a system in place, it's called Florence. So people actually take their own blood pressure and they type it into their mobile phone, and then we get it, and then we decide, the pharmacist then decide if we need to increase the medication. We're looking at group consulting so that people come together, peer support and things like that. I'm also passionate about social prescribing. I'm a farmer and I'm also a social farmer. So but I really want to talk about self-care. So I want to get a wee bit away from disease, and I want to talk about illness. So this is all about self-care. This is a definition I got from the Self-Care Forum website. So self-care is the actions that individuals actually take for themselves on behalf of and with others in order to develop, protect, maintain, and improve their health, well-being, and wellness. So when we talk about health, we don't only talk about health, healthcare and health services. We really talk about how to keep well yourself. So yeah, this is the Maslow pyramids. I don't know if anybody is familiar with this, but so when you think about your own needs and your own health and well-being needs, this can sometimes be quite helpful. So you don't really actually have to the bottom fulfilled, the needs just cross over. So you have your physiological needs, your food, warmth, water, rest, safety needs, security, safety, belonging and love needs, intimate relationships, friends, esteem needs, so that's more to do about accomplishment, and then your self-actualization, so achieve one's full potential and including creative activity. So when we start to feel unwell, there's often something wrong with one of those needs, and it doesn't, of course, always have to be a disease. So we go to the next slide. Yeah, this is a wee animation. This is my daughter wanted to put that in, so she thought it was lovely. So it's all about flourishing yourself. So this is a wee flower in the garden. So the next one. So yeah, when we look at the pyramid, so when you look at your physiological needs, so stop and think about about food. Of course, am I getting enough calories? We always talk about, oh, don't take too many calories, and sometimes we get a bit obsessed about that. But actually, you need enough calories in your food, otherwise you don't feel well. Is it nutritious? Is it balanced? Are we drinking enough? Some people get actually quite obsessed about drinking. Oh, I have to drink 2 to 3 liters of water a day. Well, actually, you just follow your thirst, and you're okay. Then you actually follow that. So when you're on a farm, you're busy, or you have a pop on your farm, and you do all those kind of things. So you have children. So then make sure that you drink when you actually feel thirsty. Have you washed? Are you warm? Are you rested? Are you getting enough sleep? 7-9 hours is kind of norm, but what is actually normal for you? And are you, of course, taking relaxing breaks? Safety needs. So, do you feel secure? Do you feel your life is stable? Are you financially secure? Do you feel safe, or do you maybe feel anxiety? And what kind of coping strategies do you have? And think about that and put them in place when you actually feel there is a bit of an anxiety issue there. Belonging and love needs. So, invest in friends, invest, of course, in your intimate relationship with your partner. Esteem needs, accomplishment. Sometimes it's actually very nice to start something new and master that. And then, of course, you accomplish something. And of course, it's important that people around us recognize what we do. So those are our basic needs. So sometimes it's good just to stand still. So that's the next slide, actually. So are you actually caring for your own basic needs? So the next one, please. So that's where I was hinting at. So when does an unmet need actually become a healthcare need? Because although the team must go to your GP, but sometimes you have to have me think, step back and think about, well, why am I feeling unhealthy? I get a lot of people in, for example, I'm tired, I have to get my blood drawn, but then actually when you sit down with them, they're just not sleeping because they're extremely busy. They're trying to hold down 3 jobs and family life, and then also, of course, try to look after their nutritious foods and a balanced diet. So that over, almost just tired because of life really. So disease is a pathological process. So that is the cardiovascular disease and all the other things that we have spoken about. So often it's physical. It can be throat infection or cancer. Sometimes it's a bit undetermined, like schizophrenia. And so there's a deviation from the biological norm, and there's an objectivity to it. So when you come to see me in my practice, I can actually touch, feel, or measure it, and I know, well, your blood pressure is a bit high, so let's do something about it. And those diseases are often very valued by doctors, especially more doctors in secondary care, of course. As GPs, we're trained to look specifically at illness too. So illness is more a feeling, an experience of feeling unhealthy, and it is entirely personal. And sometimes, of course, there can be a disease, an underlying disease, but often there is not. It doesn't mean that you don't feel well. You still can feel quite unwell. Sometimes illness does exist when there's no disease, can be found. So then you do decide you feel tired or you feel not well in yourself, and then when you come to the doctor, the nurse, or so many different healthcare professionals in primary care, of course, nowadays. So then what we do is we exclude that major pathology, we exclude a disease, or we find a disease, and that maybe needs more investigation or referral. But of course, also explore illness with you. So IDs, like I'm also GP trainer, so we are always very much into, learn to ask about IDs, concerns, expectations. A lot of people think, well, why does the doctor ask me that? It's so extremely important to know that we know about your lifestyle and about stresses in your life and what you actually are worried about. And then we can address that. And so we try to do that always in a patient-centered way and with an agreed management plan. It's sometimes good, of course, become reassurance. And we would use behavioral interviewing, because sometimes you know that you're doing something and your life is maybe not fully in balance. And as I said about the tiredness, for example, that you have to do something about it. So we try to coach you then through those lifestyle changes. So I like always this Helmond's Volk model. So when you go to the doctor, well, why are you actually going? Well, what is actually happening to me, and why is it happening to me? There could be concerns about disease, of course, but also sometimes you just want to explore together with your doctor, your nurse, or what is going on, and why is it happening to me, and why now, and what would happen if nothing were done about it? Is it dangerous? Am I going to get really ill if I don't do anything about it? And what should I do about it by myself, or who actually can help me? And it can be different people. It can be, of course, also talking to your social prescriber and getting linked into your community, especially in rural areas. I think that is extremely important, isn't it? And then, of course, the doctor. What can the doctor actually do for me? Yeah. So I'm trying to do it really quickly, Lydia. Hopefully, I'm still
No, you're good. Keep
Yeah. But
You're
we can
good.
go to the next one, because we already spoke a bit about this one. That's more summary. So on to the next slide. Yeah, of course, sexual health, we have to talk about it, contraception, menopause, things like that. I get a lot of women in, talking about that. HRT has got a lot of media attention recently, which is good. It's underused, and it is really not that dangerous at all. So what actions can you do? Take yourself. So yeah, go on the internet, but use the right information. So next slide, please. So here are a few kind of links that I think are quite useful. So
great. And all these, just to reiterate, all these resources will be sent to you afterwards. So don't worry about trying to write down addresses, email or website addresses.
Thanks. Yeah, this is more about HRT again. The risk. I get a lot of women say, "Oh, I don't want to take it. I have an awful life. I'm sweating. I can't sleep." And I also go, yeah, but look at the risks. The risks are really, really minimal. And for example, if you're a perimenopausal woman, so you're 45, you have maybe your periods are a little bit heavier. Think about having a merino coil, and then if you get a patch like an estrogen patch, it actually has no increased risk for any of the the risk that are associated with HRT. But again, it is also about if you're obese or you smoke, the risks of getting breast cancer really increase your risk of getting breast cancer, and HRT is only really minimal. So next one, your mental health. I think it's so important to look after your mental health, and we all do that in a different way, isn't it? I love just get on the tractor and mow some rushes, or go to the garden. I think in a rural area you have all those things, isn't it? But we all do it in different ways. And I can look at what you have in your community. Is there maybe local counseling service if you really feel you're struggling, or is there a local health living center? And of course, look at the local or the regional, like Aware, and there's also very good apps also. Again, the technology, there's so many apps now that you can use also to work on your mental health yourself. Next, yeah, I really think the concept of CBT is, I think it really helps to think, well, if I feel a bit stressed or overworked, because has been said a few times, our GPs are so busy at the moment, but if you feel overworked or so, sometimes you get thoughts, what are you thinking? How are you? I feel stressed, and you get emotions because of that. You feel, I'm not doing that well, I'm not coping, and then you start to behave differently. You start to maybe, sleep more or sleep less, or not looking after yourself. So I always say to people, well, if you are stressed or you suffer mild depression, don't try to change your thoughts, and don't try to change your emotions. The ones that you have most control over, and I think that really resonates maybe with rural folk more so than even with city folk. You can actually change your behavior. So and the strange thing is, when you change your behavior, your feelings can go with it then too, and you start to feel better. So it's all in that cycle. The aches and pains, I think we already spoke about that a wee bit, isn't it? The next slide just gives a few website. I think, again, especially the repetitive strain injury, like tennis elbow and problems with the shoulder, often has more to do with what you're doing or how you're sitting at work, or what you're doing on the farm. So have we think about that, because sometimes it's just about changing that and you feel much better. We spoke a bit about blood pressure and cholesterol. And again, here are a few websites that could be helpful. So all advice in the world will never help you until you help yourself. And that, of course, has to be our motto tonight.
Okay. Yeah, no, great. Thank you, Miriam. A lot of information there, but as I say, the slides will be sent to you afterwards. So don't worry about kind of all the web addresses that have been shared. We lost Rachel there just due to internet connections. Rachel, can we bring you back in again? Just briefly, there was a couple of questions there for you. Just regarding the breast screening, if we can pick up on that, just a question, is there screening in place for young women aged 25 to 45 who have a family history of breast cancer? Any advice on that?
As I say, the Action Cancer screening starts from 40 and covers 40 to 49. There's no screening program in place for women below the age of 40, but for women or young women who have a strong family history of breast cancer, ovarian cancer, who maybe are concerned about their own risk. It's always worth discussing with your GP because there are family history breast clinics in place. If your risk is deemed high enough, then you would be referred on then to one of these clinics.
Okay, thank you. Okay, guys, I'm conscious of time. We're going to move on to Veronica Morris now, who's Chief Executive of Rural Support. So, Veronica, can we hand over to you? And again, guys, if you have any questions, feel free to pop them in the chat. And if we've time at the end, we'll maybe just double back to Rachel, who wanted to cover a wee bit more on menopause, if that's right. But we'll move on to Veronica and give her her place now. So, Veronica, over to you.
Thank you, Lydia, and thank you to all the panelists as well. So much useful information has come through, I think, from the discussions here tonight. Rural Support works with farming families to help them to become stronger, both as individuals, but also for the farm business itself. And we do work with women quite a lot. But often it is in the role of where they are asking for help for their partners or for often their sons and sometimes their daughters as well. And it's only when you would get out onto a farm as part of our mentoring program, where we go on farm to assist, where you would recognise that the women are not speaking up about their own health and well-being, particularly around emotional health and mental health. Our organisation focuses on self-care and prevention where possible, whether that's in relation to the business or whether it's in relation to the individuals themselves. I think what I have taken from tonight's discussion is the fact that we have to become much more involved in managing our own health and well-being. We have to really look critically at self-care and how much responsibility we each take, particularly as women, to look after ourselves, because our focus tends to always be about looking after everyone else. And self-care really needs to be a daily practice, and it needs to be seen as a necessity as opposed to a nice to have. And often that starts with women being able to speak up and use their voice, and to speak to the pharmacist and to speak to the doctor and make sure they are asking the questions. Sometimes that's not easy, particularly if they're asking for themselves. Sometimes it's around setting boundaries as well and learning how to say no, which isn't easy for women, particularly in this sector where our value is often measured around how much we can look after everybody else. But you can't give from an empty cup, as they say. So I think it's really crucial that we support each other and that we encourage ourselves and our colleagues and our families to speak up. What we see a lot within Rural Support and where health seems to fall down is around where stress isn't managed properly, where exhaustion creeps in. People aren't planning ahead. They aren't planning from a viewpoint of prevention. There's a lot of talk often around how men would put the farm and the farm business before themselves, and their animals indeed before themselves. But women do it as well, because they put everything and everyone, as well as the farm business and the animals, in front of themselves. So I think we want to just try and encourage that there to be a sea change around that. I have a little slide. I think if we could ask Neil to share the screen. We have set up a new farm support hub as really a first step for farmers and farming family members to go to find information, useful resources that they can download, videos that they can watch that encourages that self-care and that prevention over cure. There is a short video and we're going to try and run it, and that will tell you everything about the hub, and then we can maybe touch on a few of the points after we've seen it.
Welcome to the Northern Ireland Farm Support Hub, which has been developed in partnership with HSE NI. It provides a practical, at your fingertips resource for the farming community across Northern Ireland. The Resources Hub is free and confidential to use, and the content has been specifically tailored to assist in situations that are familiar to many farmers and farming families right across Northern Ireland. They could be financial and business concerns, animal health and welfare, or physical and emotional health and well-being. We also provide services related to bereavement and loss.
One of the key reasons we have developed this resource hub is so that we can reach out to as many people in the farming community as possible. We know from experience that effective planning through early intervention, accessing the right information and getting one-to-one support are essential to tackling the root causes that are affecting the farmer, the farm family and the farm business. This dedicated and farmer-focused resource can be used at a time that suits you, at your pace, and is completely free and confidential.
Farming in Northern Ireland isn't just a job, it's a way of life, and we understand how challenging and yet rewarding this can be. Our support hub has been developed to shine a light on these challenges and to find solutions to issues facing our farming families. Rural Support's aim is to provide practical and professional support to farmers, farming families and their businesses across Northern Ireland.
The information provided through this Resources Hub can be divided into 4 main areas: farm business and finance, health and well-being, future planning and succession, and social farming and innovation. There's something for everyone with information about our resources, our workshops, our training events, our seminars, and also opportunities to find out how to access counselling and emotional support. The well-being of our farming community and our farming families is at the heart of what we do at Rural Support, and we want to provide the best support that we can for you.
Rural Support is here to work with you by helping you plan and explore your options, helping you to make the best decisions for you, your family and your farm business. To find out more or to get in touch with our staff directly, you can contact our office line on 028 8676 0040 or email info@ruralsupport.org.uk.
That's lovely, thank you, Neil. So I would encourage you to go to the hub. All of our services are provided free of charge. We also have recently launched a bereavement and loss support service for farmers and farming family members, and that provides counselling, trauma support and business and financial and technical support as well for people who've lost a loved one or been affected by a farm accident. The hub is there to be used. It will evolve over time. It complements the services that we already provide within Rural Support, and all of that information is readily available. I just want to say, probably just in conclusion, the role and importance of women in the farming enterprise cannot be underestimated. And I think, you know, as women, we do tend to take a back seat. We're much more comfortable there, particularly in rural families. If we are going to have that role, whether we're up front or whether we're behind the scenes, we do have to take responsibility for looking after our health and prioritise our health. I saw a quote today and I thought it was really relevant for tonight because, you know, we deal with some really challenging cases. The complexities that are there within our farming families, really until you see them, you wouldn't believe they were possible. So we don't know what load people are carrying when we're talking to them or when we're working with them. And certainly as professionals working in this sector, we have to be very conscious of that. The quote I saw said, just because someone carries it well doesn't mean it isn't heavy. And as women, we do tend to carry our loads as if they're not a load. So really we all need to be quite conscious of other people, try and be as kind as possible, and to recognise that it's okay to step back and take time out and to do, as Miriam suggested earlier, which is develop a process of self-care. So that's probably my lot. Any questions, happy to take them, of course, Lydia, and thank you.
Yeah, thanks so much, Veronica. I'm just noticing here in the attendee list, Noreen, we've got your hand raised. Are you okay to ask a question? I can give you permission to talk. I can press the button, see what happens. So go ahead and unmute yourself. I haven't done this before. Are you there, Noreen?
Noreen, if you're there, you should be able just to unmute your microphone there, but
yeah,
you locked up your hand, just you press the button. But
possibly, I'll give you a wee second.
No worries if not.
No. And maybe just up by accident. Okay, no worries. But look, we have a couple of minutes left. We'll double back maybe to Rachel just to finish off on the menopause piece, if that's okay, Rachel. Just to add, obviously we lost you. I cut you off and then we lost you on the internet. So if you just want to maybe top up for that, and then we'll see if there's any final questions coming through on the chat then that we take from people.
Yeah. So menopause. I know Miriam has briefly sort of just went into it a bit, so I'll just kind of go through quickly and then sort of key messages. So menopause literally just means last menstrual period. Thought it was another good branch of some women's health to talk about, because all women will go through the menopause, and through my work I have seen menopause can cause a significant impact on a woman's quality of life, family relationships, family dynamics at home, and their ability to go to their work even. And sort of some of the figures around it, 51 would be the kind of average age that a woman would go through the menopause, but menopause can occur much earlier than that or later. Menopause, or having your last period before the age of 45, is actually classed as an early menopause. A lot of women, whenever they're sort of come and mention that they're having hot flushes and sweats and things, they get all excited about, can they get the menopause blood test done? But the menopause blood test, the FSH levels, only really helpful if we suspect that you're in early menopause, so symptoms or problems with your periods before the age of 45, or indeed where it's used to sort of determine your need for contraception or that. So basically the diagnosis of menopause, or perimenopause we call it, when you're going through all those symptoms, is just made basically on the symptoms and things that you're telling us. There's an endless list of symptoms. The most common ones people know about, obviously, is your hot flushes and sweats. Other symptoms that people might not know that may be attributed to the menopause can have a significant impact on mental health. So it can cause mood swings, irritability, anxiety, insomnia, poor concentration, brain fog, can affect your libido or your sex drive. Can also, in the later stages of menopause, contribute to recurrent urine infections, cause urinary symptoms and urinary incontinence, and cause problems with painful intercourse and things as well. So if you're experiencing any of these things that you maybe just thought, oh, that's just part of getting old or whatever, just speak to your doctor about it, because there's lots can be done. With going through the menopause as well, it means that you're then obviously at increased risk of developing osteoporosis or brittle bone disease, it's kind of colloquially known, and increased risk of heart disease then as well. HRT, as Miriam briefly touched on, stands for hormone replacement therapy. This is one of the treatments that we can use for treating menopausal symptoms. It's basically replacing the estrogen that your body is now lacking, and it's the lack of estrogen hormone that causes all these symptoms. So it's just a way of replacing that, and it can be given by tablets, patches, gels. There's lots of different options there. A lot of women, kind of in the past, there's a lot of media scare about the risk of breast cancer associated with HRT. I don't know if anyone watched the documentary with Davina McCall earlier in the year, Sex, Myths and Menopause. It was worthwhile watching, and I found that she had kind of tried to broach this taboo topic of menopause, and after that there was a massive influx of women contacting the GP surgery looking to get started on HRT. So it was a very, very worthwhile and reassuring documentary, and I think you can still watch that back on your Channel 4 player. So just a wee bit on the risk of breast cancer. With that, basically what I tell patients is that being overweight or drinking alcohol to excess actually increases your risk of breast cancer more than taking HRT. So for most women, depending on your history and things like that, HRT, the benefits outweigh the risks and can substantially reduce menopausal symptoms by up to 80% in most women. And a lot of women come back and say that it's changed their lives. It's really sad. I just really love HRT and treating menopause. I just find it so satisfying because women come back with such great outcomes. Obviously it's not for everybody. It's not suitable for everybody. So just have a chat with your GP if you want to think about it. And Menopause Matters, it's one of the websites Miriam mentioned, is a brilliant resource for patients. There's lots of different leaflets and things on there that are aimed at patients, so you can have a wee look at that. But that's kind of it.
Great, thank you so much for that, Rachel. Okay, well, like what a wealth of knowledge and information in this on the panel tonight. Unbelievable in terms of the knowledge that we have here. I just want to invite Jennifer Hawkes to say a few words just to wrap up for us this evening before we close down sort of in the next minute or so. So Jennifer, are you still with us?
I am, but I see I've gone quite dark and I've every light about the place on. So
Oh, you're on mute. I was going to say we've lost you.
Have you lost me? Oh, can you hear me now?
Yes, I can indeed.
I see I've gone very dark, so I do apologise, and I've every light, as I say, on about the place. But anyway, just on behalf of the Ulster Farmers Union Rural Affairs Committee, I'd like to thank Women in Business for their kind invitation to run another Women in Agriculture event, and of course for hosting this evening's webinar. In particular, I'd extend our thanks to you, Lydia, for chairing the proceedings and keeping it running along, and to Neil, who's been working very hard there behind the scenes for ensuring the smooth running as well of this evening's webinar. I have to say thank you so much to our fantastic panel. You've given us so much to think about and a whole new toolkit, I think, for us all in self-care and in recognising what we can do to minimise the risks of serious illnesses for ourselves and to reduce our aches and pains. So a sincere thank you, and I'm just looking at everybody across the top of my screen, to Miriam and Rachel, Lindsay, James, Michael, and of course to Veronica, by no means least, for taking time out and joining with us this evening. It's very much appreciated, and I know you already have a very heavy workload, and just on behalf of the Farmers Union, thank you for everything that you've been doing throughout the pandemic and all the work that lies ahead of you still. A special thank you has to go most definitely to Rebecca, for all her assistance in researching this evening's content and for securing our wonderful panel. Thanks also to Sarah, our Policy Officer in the Rural Affairs Committee, for liaising with Women in Business, and of course to all of the listeners that joined us this evening. Thank you, and I hope you have enjoyed the discussion, the wee bit of banter, and are taking something away that really will improve your own well-being. And to Michael, I am wearing my Fitbit, but alas, I haven't done my 10,000 today, but I'll try and do better tomorrow. So thank you, everyone, and have a really good night.
Thank you, Jennifer, and our pleasure as Women in Business to host it. Certainly we could have probably had an hour on each of those topics alone tonight. So we do always send out a little evaluation form after our event. So do take a moment to complete that. And we will obviously look to schedule something else in early 2022 with Ulster Farmers Union. So let us know the topics that you want to hear about, and we'll organise another event for early next year. But thank you so much for everybody for your input. It's been a pleasure hosting you, and we look forward to seeing you online again soon, or maybe in person in the future if COVID behaves itself. Okay, take care, everybody. Thanks so much. Bye.